that a small subset of patients benefit from the addition of a taxane to the chemotherapy regimen. However, this comes with increased toxicity. So up to 47 patients experience peripheral neuropathy, which can have severe and long-lasting impact of the quality of life. So, and many biomarkers have been proposed in the literature, and extensive preclinical work has been conducted, but none of these markers made it to the clinic. So with this trial, we want to validate these biomarkers in a randomized controlled trial called the MATADOR study. And we do this as a post hoc analysis. And a previous result already showed that stromal infiltrating tumor lymphocytes can predict taxane response in triple-negative breast cancer. But now we tested 13 immunohistochemical biomarkers, including the famous ABCB1 multi-drug resistant protein, EBCB2, EZH2 as a part of the polycom repressive complex, and 2 tubulin markers. Patients in the MATADOR trial were randomized between a taxane and a non-taxane regimen. And all subtypes were included without breast cancer metastasis. Most patients were node positive, and we obtained a score of around 600 or 360 HER2 negative ER positive breast cancer patients, and around 100 triple negative breast cancer patients. With a median follow-up of 10 years, we found that ABCB1 is a prognostic marker in hormone receptor positive HER2 negative breast cancer tumors, but has no or only limited predictive power to predict if the one treatment regimen is in favor. But in the triple negative subgroup, we found a significant interaction between EZH2 and treatment. So high levels of EZH2 were associated with the improved survival after taxane treatment, while the point estimate for low EZH2 showed favor of dose-dense AC. From previous results and in vitro data, we know that patients with high TILs have an improved survival after taxane treatment. However, we do not see a difference between patients with high or low immune cells after dose-dense AC treatment. If you compare the stromal infiltrating lymphocytes and the EZH2 scores for these patients in triple-negative tumors, we see a strong correlation. And especially when both biomarkers are high, then we see only a few events in the taxane-treated group, while we see a lot more events in the dose-dense AC-treated group. Unfortunately, this study is small, so it's important to validate this in another cohort. And